Has this ever happened to you? You get up in the middle of the night to go to the bathroom and then you ram your big toe into some piece of furniture. Big toe pain can be excruciating. Whether you felt a sudden jolt from stubbing your toe in the dark, experienced pain from an ingrown toenail, or injured your toe playing sports, you know what I'm talking about. Let's take a look at the 7 common reasons for big toe pain and what you can do to treat and prevent it. But before I do, I'd like to introduce myself. I'm Dr. Ryan Berg, and I've been practicing podiatry for over 40 years in Seattle, Washington. I've written an ebook called No More Foot Pain to help you learn about a wide range of foot conditions, some of which we'll talk about here today. Please check it out in the description below. Also, if you find this information helpful, please remember to like, hit the subscribe button, and then hit the bell so you can receive a notification every time I release a new video. In my introduction, I mentioned 3 reasons for big toe pain. We'll go over these first, and then I'll discuss 4 others. First is stubbing your toe. While this may seem like a fairly minor injury, it's still important to see your podiatrist to ensure that the toe isn't fractured or infected. In addition to pain, you may also notice bleeding under the nail, bruising and redness, your skin, swelling, and difficulty putting any weight on your foot. Some things you can do at home include rest, ice, compression, and elevation. The first is rest. It's important to stop any physical activity and rest your foot. Second is icing your toe. Use a cold compress or frozen peas 20 minutes on and 20 minutes off over the next couple of hours. Third is compression. Use an elastic bandage to wrap your foot to reduce swelling. Finally is elevation. Keep your foot above your heart level as much as possible for the next 72 hours. You can also try buddy taping. That's taping your big toe to your second toe and even to the third toe using elastic tape. And you may also need to wear a walking boot if your podiatrist prescribes it. To prevent toe injury, be sure to wear supportive closed-toe shoes and consider using a nightlight in your bedroom for safety. Ingrown toenails are another very common reason for big toe pain. Risk factors for the ingrown toenails are wearing shoes that are too short, trauma to the nail, and improperly cutting the toenails. We treat ingrown toenails in our office with the same day surgical procedure that has minimal recovery. Next, if you're an athlete, you may have experienced an injury called turf toe. It's a very common injury among football and soccer players, but it's also seen in gymnasts and dancers. It occurs when the toe bends too much or too far with force as you're participating in your sport. Symptoms can include pain and tenderness, swelling and bruising, and very limited range of motion or an unstable joint. Immediate treatment is the same as for the stubbed toe: rest, ice, compression, elevation. Treatments at our office can include custom orthotics, treatment with MLS laser to reduce pain and inflammation, and referral for physical therapy. Wearing supportive shoes will help with the treatment and prevention of this condition. Without treatment, this condition can lead to long-term stiffness in the big toe, called hallux rigidus, where the great toe becomes more and more limited in movement. Next is the tennis toe, or runner's toe. While tennis toe occurs in tennis players and runner's toe in runners, the condition is also common in other sports like pickleball, racquetball, soccer, hiking, and skiing. It occurs when the toenail is the top of the shoe repeatedly. The primary symptoms are pain and bleeding under the nail, which will cause the nail to turn black or purple, even fall off. To treat it, keep the area clean and covered and use an antibiotic ointment. Keep the nail attached as long as possible if you notice it coming loose by using a Band-Aid. While treatment of tennis toe is very simple, this condition can also lead to toenail fungus, a much more difficult condition to treat. You can learn more about that condition in the description below. To prevent tennis toe, keep your nails trimmed and wear shoes that fit. If you have trouble keeping your foot from sliding forward in the shoe, use a lace lock, the lacing technique. I'll put a recommendation about this below. Next is sesamoiditis, which is an overuse injury characterized by inflammation and swelling and sensation bottom of the great toe joint. The sesamoids are 2 pea-sized bones that float under your great toe joint like your kneecap floats on top. Increased pressure on the sesamoid bones, the common dancers, runners, baseball players as you pivot over the foot. Women with high arches who wear high-heeled shoes are also at risk of excess force in this region. Symptoms include pain under the big toe or ball of the foot, difficulty bending the toe, and swelling and bruising. In addition to many of the same treatments I've mentioned already for other big toe pain conditions, padding and cutouts to take pressure off can really help alleviate this condition. We also use cortisone to reduce the swelling. Next is hallux rigidus. Turf toe or even a stub toe goes untreated, it can progress to this condition called hallux rigidus, a painful condition of the big toe, in which the great toe becomes more and more limited. Causes are overpronation, too much stress on the big toe through work, conditions such as rheumatoid arthritis or gout, or conditions in which the first metatarsal bone is elevated, and usually that's congenital. Symptoms of pain, stiffness, and particularly when you walk or go up on your toes, will become evident very quickly. The primary treatment for hallux rigidus, custom orthotics for controlled foot biomechanics and pain, I recommend a rocker bottom shoe which avoids stress as you come forward over the joint. Some such shoes that do this are Hoka, New Balance 928, Dansko, and Allegra. Surgery may be necessary if none of the conditions that we described are controlled by conservative treatments. The last condition I'm going to talk about causes big toe pain is gout. Gout's a painful inflammatory condition caused by a buildup of uric acid in the joints. Patients won't experience the symptoms of gout all the time, but will experience gout attacks intermittently. These painful symptoms are most often brought on by eating certain foods that are rich in amino acids from proteins, such as red meat, wine, cheese, chocolate, and some medications. People can also be at risk for this condition if they are overweight, have congestive heart failure, high cholesterol, diabetes, kidney disease, or high blood pressure. Controlling gout includes avoiding the foods and drugs that can increase uric acid levels and taking medications to lower these levels. To learn more about how to reduce your risk for gout, click on the link below. In summary, big toe pain can put a crimp in your lifestyle by making it difficult to walk and play sports. Even if you think your big toe pain is minor, it's still important to come in and get evaluated. It doesn't progress to something much worse that can be hard to treat later.